Good morning. I'd like to start this Lupus Awareness Month proclamation first by welcoming our guests, and I'm going to flip the order here. I'm going to have them introduce themselves first.
All right. Hi, I'm Petra Chuante. I am a committee planning member for the Lupus Foundation of America. I've had lupus for 33 years, and just every single day of life is different, just to let you know. Thank you for having me.
Hi, my name is Sahana. I am with the DC Committee for the Lupus Foundation of America, and I've had lupus for over half my life now, so it's been a struggle, but very fulfilling when we have good days.
Hi, good morning. My name is Natalie Myers. I also have lupus. I've had lupus since I was 14, so almost 15 years now.
Hi, my name is Zara Imana. I work in at NIH at Lupus Clinical Trial Unit. I'm working as a data manager.
Good morning. My name is Elaine Poncio. I'm a research nurse coordinator at the Lupus Clinical Trials Unit at the NIH.
Good morning, my name is Isabel Ochoa Navas, and I am the patient care coordinator for the lupus patients at NIH.
Good morning, my name is Sarfraz Hasni. I'm the director of Lupus Clinical Research and the head of the Lupus Clinical Trials Unit at the NIH.
Thank you so much, and we're going to hear from you all shortly, so I know I confused you by making you go first. I apologize. So we have representatives from NIH, from Lupus Foundation, and we're raising awareness about lupus. I've chose, as many of my colleagues do, to raise awareness about issues that we might not talk about a lot during these proclamations, and this is certainly an important one. It's also a personal one. I spoke a couple months ago, or last month, about during Autoimmune Month, about my wife who was diagnosed with lupus just about 6 years ago, and that journey and how difficult it's been. That was after the birth of our first son and our fourth child. Lupus is an autoimmune disease that affects about 1.5 million people in the United States. Of the 50 million U.S. citizens who have an autoimmune disease, 75% are women, and that's also true, and it's even more true for lupus. Intersectionality really matters here. It's not only a health issue, but it's a women's issue, it's a race issue, and lupus, like many autoimmune disease, disproportionately impacts certain members of our population. Black and Latinx women are more likely to have lupus at a younger age and are more likely to have severe symptoms. But obviously it can impact anybody. 9 in 10 of those who are living with lupus are women. And it's a very serious condition, but it's also really hard to detect. And I'm sure you'll hear from some of our lupus warriors here about that. You can try to rule out many other things and not know what's going on with you, which can be really, really frustrating. It's one of the reasons we have to make sure that there's more awareness about what the signs and symptoms of lupus are. It's also an area where we need more investment and more research. And you'll hear from the folks at NIH who are on the forefront of trying to make sure that there are better and more effective treatments for those with lupus. And I just want to thank everyone for coming out today. I want to thank my wife for being a lupus warrior. She's busy working today, but she sends her love. And I would hope that after you hear these stories today and hear the stats about the proclamation, that you will be more attuned in the public to folks that are struggling with this and other autoimmune diseases. If you're dealing with it yourself, go get screened, learn more about it, because that's really, really a big issue. It takes a long time for a lot of people to get diagnosed, as you'll hear from some of the folks today. And I want to thank the Lupus Foundation for doing the critical work that they're doing to provide a better future. And I want to thank, in particular, Liana Bennett from the Lupus Foundation of America for bringing the great representatives who we're going to hear from momentarily. And so first, I'd like to bring up our lupus warriors to just give a brief testimony. We can go in whichever you want to. You ready? All right, come on up.
Hello. As I said, my name is Sahana. I was diagnosed with lupus nephritis, which is a type of lupus that affects my kidneys because there's so many different kinds. I was diagnosed in middle school, and I am now in my 30s, so I've been living with it for a while. Every day is really a mystery, and I think that's why they call it the cruel mystery. But I have been living a very fun and adventurous life with thanks to my doctors and my support system. But I think that it is very important that we spread awareness because there are days where people may look at certain people that you can't tell that they have these invisible illnesses, and it is a struggle to have to continually just explain yourself, and sometimes you feel a little bit guilty trying to do that and ask for accommodation. So I think it's very important that we continue to spread awareness and do more research so that hopefully one day we can get on a better track. But for now, I hope that everybody continues to do what they need to do and are also living the best life that they can. Thank you.
Good morning again. My name is Petra Chuante. I've had lupus since the tender age of 18, a senior in high school, running track for many years, and then it just happened. So I pretty much grew up all my adulthood having lupus. I have a great rheumatologist. He was actually a resident in the hospital when I was first brought in and couldn't walk, and he's still my rheumatologist till today. So I'm happy to have him. I take my medication. I live a pretty much normal life. No one would be able to tell I had lupus if I didn't tell them. I'm so grateful for the Lupus Foundation. We provide awareness, we do walks, we raise money, and just keep people abreast of this terrible, ugly disease. Thank you all for being here and listening.
Hi, good morning, everyone. As I said, my name is Natalie. I was diagnosed with lupus when I was 14 years old. Like everyone else, is quite young. And I think in general, we don't take women's pain seriously. And that's why on average, it takes more than 6 years to be diagnosed with lupus. And lupus, like mentioned earlier, can be misdiagnosed as many other diseases as mine was. This can cause faster progression of the disease, worsening of symptoms for many of those living with lupus. That's why early detection and early treatment is so vital and why we need innovative treatments to treat lupus. Thank you.
I'm so glad that you mentioned, all of you shared your story and mentioned that. I'll just share a brief, and then we'll hear from Dr. Hassani and read the proclamation. I remember vividly my wife coming home from the metro. She was working downtown, and she was literally limping. And she was like, well, I'm fine. Nothing's wrong with me. I'm going to be okay. That happened for several days. And I said, no, something's actually wrong with your joint. Like, this is not normal. And sure enough, we went and got diagnosed, and it kept moving. It was different joints, right? That's one of the ways it presents in some people. It can present differently. You heard you couldn't walk. It's literally that debilitating. And the focus on women's pain, not only as a society we do that, but women themselves are socialized to suppress pain and not go get diagnosed. And that was certainly the case with my wife. So just, again, for anyone out there, be aware of the signs and symptoms. And last, we'll hear from Dr. Hassani, who heads the National Institutes of Health Center and Research on Lupus.
Good morning, and thank you to the council members, and especially Councilmember Jawando for bringing this awareness of lupus, which was rightly mentioned as a cruel mystery. As Councilmember just mentioned, it's disease which predominantly affect women. 9 out of 10 patients are women, and those are young women in their 20s and 30s. But the point I wanted to emphasize is that the risk of getting lupus is not evenly distributed. Even though anyone can get lupus, black women are especially more susceptible to get lupus. So 1 in every 250 black women can get lupus. And not only they can get lupus, their lupus can be much more severe. So a black woman diagnosed with lupus at the same time a white woman diagnosed with lupus is expected to live 13 years less than her counterpart in other ethnicity. And similarly for the same goes for the Latinx women also, that their disease is much more severe. So we at the National Institutes of Health at NIAMS, which is the National Institutes of Arthritis, Musculoskeletal and Skin Disease, are trying to find out why there are racial and ethnic differences in terms of incidence and severity of this disease. So I head the Lupus Clinical Trials Unit, and we are engaged with our team to find out why there is this discrepancy. One of the challenges that we have identified is that there is a disproportionately less involvement of people of minorities, especially black and Hispanic patients who participate in clinical research. So even though their risk is disproportionately high, their participation in clinical research is less, and we are trying to overcome that barrier by making sure that there is a proportionate involvement of them. So they're underrepresented, but we want to make sure that they are represented equally. So we have gone into community engagement here in Montgomery County and the surrounding areas, and we go and talk about and do bring awareness and see if patients we have increased participation, so we can understand when they participate in clinical research why this is going on and what we can do to improve the outcomes. So we have created this forum called the DC Lupus Consortium, and we meet where all the patients, patient advocacy groups, and physicians come and discuss what we can do in terms of learning about lupus and do for research. Our event is coming up on May 31st, our yearly event. We have information. If any of you are interested in coming, we can provide that information for you. And lastly, of course, it takes a village to do things like that. So I'm eternally grateful for my team. Elaine, Isabel, and Zarai are here, but the rest of the team are not here in person, but I know they're watching. But I think with the time constraint, I cannot name everybody. But I do also want to acknowledge that there is unwavering support of the leadership, especially Dr. Lindsay Criswell and Dr. Mariana Kaplan, who have been spearheading these efforts, and I with my team are also working there. And of course, none of this is possible if the patients and the warriors and the survivors of lupus are not participating in clinical research. So we owe it to them, and we encourage and request all of them to participate in clinical research. Thank you so much.
Thank you, Dr. Hassani. We'll definitely share the event, and really we're so blessed to have NIH here in studying this disease and working to make sure that people have a better life. I'm going to read the proclamation, then we'll take a picture. Whereas Lupus Awareness Month is celebrated each May to raise public understanding of this chronic, non-infectious autoimmune disease. Autoimmune diseases cause the body to attack its own healthy tissue, causing a variety of problems. About 1.5 million U.S. residents are living with lupus today, and 9 out of every 10 people with lupus are women. 15% of those diagnosed with lupus are children. And whereas there are 4 types of lupus, with systemic lupus comprising around 70% of all lupus cases. Systemic lupus impacts major organs like the kidneys, lungs, heart, and brain. Signs and symptoms of lupus can appear inconsistently for years, including hair loss, headaches, painful or swollen joints, photosensitivity, swelling in the feet, legs, and hands, and around the eyes, anemia, and pain in the chest. And whereas lupus impacts populations disproportionately and disparately, Black and Hispanic women are more likely to get lupus at a younger age and experience more severe symptoms. The disease can affect anyone at any time, especially women between the ages of 15 and 44. Lupus can become severe and debilitating and is one of the leading causes of death among all young women. And whereas the cause of lupus is still unknown, and on average, diagnosis occurs 6 years after the first signs appear. While treatment can be costly to access, the average person with lupus takes 8 prescription medications. More research is required to prevent and effectively treat the different types of lupus. Through public awareness and advocacy, it is possible to reduce the time to diagnose, improve access to safe and effective treatments, and expand direct services to create better outcomes for anyone diagnosed with this disease. Now therefore be it resolved that the County Council of Montgomery County, Maryland hereby celebrates Lupus Awareness Month, and be it further resolved that the County Council encourages all county residents to do the same. Presented on this day, the 21st of May, 2024, signed by myself and the Council President on behalf of all council members. Thank you so much, and let's take a picture.